Chinese officials tried to keep the outbreak quiet.
门口放着10几个氧气罐。
All through January, social media lit up with claims of censorship by the communist government, and citizen journalists who reported on the outbreak disappeared. Video posted online showed non-infected people being dragged out of their homes and taken away as supposed patients after reporting on social media. International journalist and war correspondent Michael Ware says China has a poor track record of telling the truth.
Obviously, that's one of the problems that the global health community is facing. It has to be able to decipher the official reporting from China versus what unofficially may be happening. And quite frankly, there is no simple way for us to know.
One of the first people to go public was Wuhan ophthalmologist Li Wenliang. On December 30, the day before China alerted the World Health Organization, he sent a message to a group of colleagues about a possible outbreak. Days later, he was summoned by police and reprimanded for making false statements and disturbing the public order. He went back to work at the hospital, but a week later developed symptoms himself and died on February 6.
He simply messaged all his medical school graduate friends from his year to say to be on the alert for this new disease. Then the Chinese government shuts him down. The next thing we know, he's in a hospital bed with coronavirus, and then he dies. It's very hard to look behind the official numbers, and particularly in authoritarian regimes.
China downplayed the spread. Even after it crossed international borders, the director of the government's Wuhan Centre for Disease Prevention insisted the outbreak could be controlled.
With the effective measures put in place, we can prevent and control the disease from spreading.
China's evasiveness has led to many conspiracy theories, particularly about the source of the virus. US Senator Tom Cotton says China is lying.
This virus did not originate in the Wuhan animal market. Epidemiologists who are widely respected from China, who have published or studied in the international journal The Lancet, have demonstrated that several of the original cases did not have any contact with that food market. The virus went into that food market before it came out of that food market.
He thinks it escaped from a lab.
We also know that just a few miles away from that food market is China's only biosafety level 4 super laboratory that researches human infectious diseases. Now, we don't have evidence that this disease originated there, but because of China's duplicity and dishonesty from the beginning, we need to at least ask the question to see what the evidence says, and China right now is not giving any evidence on that question at all.
Another theory is that the virus is a leaked bioweapon, an experiment tested on animals which either escaped the lab or was sold to local street vendors after the experiments were over.
In these circumstances, it's best to adopt a general rule about conspiracies. The conspiracy usually comes after a stuff-up. And maybe there has been a stuff-up from a lab, we don't know. We're probably never, ever going to find out. Certainly won't be finding out from the Chinese.
A novel written some 40 years ago spoke about an outbreak just like this one. The Eyes of Darkness, published in 1981, described a virus produced in a lab just outside Wuhan as China's most important and dangerous new biological weapon in a decade. It's prompted frantic discussions online, but it is just a work of fiction. The symptoms and kill rate simply do not match. So why has this outbreak received so much attention? COVID-19 is highly contagious and has spread at an extraordinary speed, particularly in China, Iran and Italy. It took just 48 days to infect 1,000 people. In contrast, the SARS outbreak in 2009 took more than 4 months to infect that many. And the 2012 outbreak of MERS took 2.5 years.
This virus, like other coronaviruses, spreads via respiratory droplets. So when people cough and sneeze, for instance, droplets carrying the virus fall quickly to the floor, usually within a metre or so of that event, and people who touch contaminated surfaces or contaminated hands and then touch their own mouth, nose or eyes can get infected.
The key symptoms to look out for are a cough and a fever. Just a snuffly nose is unlikely to be corona. It's a cough and a fever, and then maybe some increased work of breathing, shortness of breath, and then you may develop, after about a week, pneumonia, where you get pain on breathing and breathing fast and a high fever.
And it spreads much faster than other illnesses.
The coronavirus is spreading too fast. There is person-to-person transmission all over Australia, and the numbers are rising rapidly.
Chief Medical Officer Brendan Murphy says there's a good reason it's spreading so quickly.
The coronavirus has particular significance because it's a novel virus. We don't have a lot of background immunity, and therefore it has the potential, as we've seen in these countries, to infect a lot of people at the one time. And we do know that potentially around 1% of people, we don't know the exact number, can have a fatal outcome, particularly those who are elderly and frail.
1% might sound low, but if the number of cases surges, that toll will quickly add up. For influenza, every patient infects only 1 or 1.5 other people. For COVID-19, it's 2 or 3. That means even if the mortality rate is low, with so many cases, the death toll could still be very high.
If through a lot of effort we can keep the infection rate from corona down to 20% of the Australian population, that's still 5 million. If the death rate was 1%, that would be 50,000. If we can keep the death rate down to 0.1%, that's only 5,000.